Hi everyone, this lecture is going to be on an introduction to white blood cells. Normally, there are 5 different types of white blood cells or leukocytes in peripheral blood, and they are pictured here. Neutrophils have light pink cytoplasm with segmented or pinched nuclei. Eosinophils have bright pink or red granules, and basophils have blue granules. Monocytes are the largest cell type, and they tend to have blue cytoplasm, colorless vacuoles, and amoeboid-shaped nuclei. Lymphocytes are the small cell type, and they normally have a scant amount of blue cytoplasm and small, round, dark staining nuclei. In clinical pathology, we often use suffixes to denote whether a particular test result is either increased or decreased. The suffix philia and cytosis denote an increased cell concentration, whereas penia denotes a decreased concentration. So, for example, neutrophilia indicates an increased concentration of neutrophils in blood, whereas leukopenia denotes an decreased number of leukocytes in blood. Leukocytes are enumerated using 2 different counting methods, and they are the relative count and the absolute count. Relative counts are percentages of each cell type. So in this example, in the picture, there are 60% neutrophils, 30% lymphocytes, and 10% eosinophils. Absolute counts are determined by multiplying the relative count by the total white blood cell concentration. So in this example, there are 6,000 neutrophils per microliter, 3,000 lymphocytes per microliter, and 1,000 eosinophils per microliter. Of the 2 counting methods, the absolute concentration should be used to interpret a patient's results. The leukogram is a snapshot of the leukocyte concentrations in blood, so it's essentially the leukocyte component of a CBC or complete blood count. In this leukogram, there is a list of each white blood cell type, followed by their relative concentration and their absolute concentration. There are 2 types of analyzers out there, those that can differentiate white blood cells from nucleated red blood cells, and those hematology analyzers that cannot. So when you're using a hematology analyzer that cannot differentiate between the 2 populations, you have to perform a corrected white blood cell count to get an accurate white blood cell concentration. So in this example, the analyzer counted 107,000 white blood cells per microliter. But when you looked at the blood smear, you saw and counted 152 nucleated red blood cells per 100 white blood cells. So if you plug those numbers into this equation, then you'll get what's called the corrected white blood cell count, which is the actual white blood cell count in this patient. So in this case, it'll be 42,500 white blood cells per microliter. So therefore, the actual white blood cell count is much lower than what the hematology analyzer reported.